So I think you're going to hear us say this probably more times than not, that we love simulation and education. And one of the reasons that I loved simulation and education from the beginning as a trainee is that I really liked how comfortable it made me in situations when everybody was very panicked. And this is not any different than that, that you want to make sure that everybody is confident and comfortable with the device that you're using, where it's located. So know where your JADA is before you need it. We do a lot of scavenger hunts at my facility so that people know what cart that it's in, what drawer that it's in, where is it located on the unit and floor, depending on wherever you're at. Understanding where the suction tubing is, where does that connect to? Are you connecting this to the suction device that you're using in the procedure? Are you connecting to a suction to the wall? Every facility is a little bit different. Making sure that you're not creating tripping hazards and things like that so that you understand. And it's not just the physician that needs to know how to do this. Everybody's a part of the care team. That comfort level with how this works is really where I feel like we started to smoothly use this procedure in our device in our ORs, because everybody was very comfortable with what it was doing, where it was at, how they played a part in that specific situation. And then handing off the JADA into the OR. So if you're handing off JADA from the OR into your recovery team, you're sort of thinking about what recovery room looks like and how do we transport. And we really quickly realized that we needed something to be able to keep the suction going as we transported these patients. And so we actually have portable suction devices very similar to what is on our crash carts to be able to maintain suction, to be able to get them from the OR to our PACU. Have a PACU, but you do have a postpartum recovery room that they might be going to. Same thing. So we would take them with a portable suction and then connect them with a wall suction in their recovery room, wherever they're at. The last bit of information for us that I think was really important is to make sure that you know what the amount of suction you're supposed to be having. So depending on what you're using, whether it's wall suction or the suction device in your OR, you need to make sure that this is set at 80 millimeters of mercury, and that's plus or minus 10 millimeters of mercury. So you can up that to 90 if you don't feel like you have the appropriate contraction that you would like to be able to get that uterine contraction and appropriate blood control. But if your setting is different when you're using your suction during the procedure itself, you need to make sure that your team is very well versed in doing so. What about you, Dr. LaFleur? Are there any tips that you have in your OR?
Well, I second a lot of what you said, of course, and a lot of, to our nursing staff, our scrubs, our circulators, everybody being very confident about how this works in the OR. So, of course, initially going in there, and everybody's OR set up differently. So each person's got to figure out, like you said, which canister are you using? If you're using, if you're using a wall regulator that's on the wall that maybe you're not typically using in a case for suction, but of course, now that you're thinking about, okay, is JADA going to be a part of our hemorrhage control in the OR, seeing if we need to add, you need to add a suction canister to that location, where specifically you're draping the tubing, because like you said, in so many ORs, we're passing, the traffic pattern passes back and forth. And so making sure that, whatever that option is, that it's going to be a safe location to have the tubing located. And then again, like you said, big on simulation, on training, on having those conversations where not only do we know where all of our supplies are, but the nurses have thought through, the whole system between where are we going to set this up? How are we going to position the patient specifically? Who's going to have those roles in maneuvering the patient? And then once the nursing staff and the scrubs and everybody have that system sort of mapped out for themselves, one of the biggest things that I think can impact the care of patients in this particular situation is confidence. So when the nursing staff has the confidence that they know how to implement this device, it then helps with the confidence of the provider. So as a staff, if you see a hemorrhage situation and your provider may be asking for various medications and y'all are communicating about the amount of blood that's lost and you recognize that you're greater than 500, and you as a support staff member in that OR, is perfectly reasonable to say, do we want to get a JADA ready? Is this something that you're interested in? And if it is, then you competently and confidently, because you have arranged the system at your hospital so well that you know where to connect everything, how to find everything, where your sterile fluid is, and it's a very smooth system. that really improves the confidence of a provider who maybe has only used it in a limited situation, or maybe is never placed in a C-section, because they know that you have the other half of this scenario very cleanly defined. So now it's just the placement portion that they're providing, because the team has everything so cleanly set up. And I think that that's been a huge shift at our facility as well, is the general confidence of the staff really, folds over into the confidence of the providers who are placing it.
Yeah, that has definitely been just really evident in my facility, is empowering those a part of our team to participate as a team. And I have appreciated it. I know when you're handling a crisis or an emergent situation, it's really nice to have people in the room that are helping walk through those steps with you if you are managing more things than one. And so that has anecdotally worked really well in my facility too.